Good evening. I see you here for another cranial nerve exam. Very good. Now, before we continue, can I get your name and date of birth? Thank you. Now, has there been any change in your medical history, any new medication, any change in your family doctor? Okay. And is your address still the same? Same insurance? Perfect. And now, just to confirm, you haven't been sick or ill within the past 14 days. No cough, fever, headache, nausea. Very good. And now, have you been consistent with your previous medication, previous dosage? Is about anything? All right. Perfect. Now, quickly just take a quick check of your overall vitals just to get a general standing of where you are. You'll begin with your lungs. I'm just going to be listening to the breathing on both chambers, both sides, just to ensure that there's no issues in it, no phlegm and whatnot. Very good. I'll get you to hold still for me. Take a deep breath in and slowly release. Very good. Take a deep breath in and hold it. 5, 4, 3, 2, 1, and release. Do that one more time and we'll switch sides. Take a deep breath in. 5, 4, 3, 2, 1, and release. Very good. Now just on the other side. Take a deep breath in. 5, 4, 3, 2, 1, and release. Take a deep breath in. Hold it. 5, 4, 3, 2, 1, and release. Very good. There doesn't seem to be any issues in regards to that. Now, have you had any heart pains lately? Any heartburn? Yeah. Okay. I'm going to get your blood pressure first, and then we'll be looking at your heart right after. I'll ask you to hold very still for me. I'm just going to wrap this around your arm here. You'll feel a little bit of pressure, a little bit of overall tightness on your arm. That's to be expected, not to worry about that. If it is too painful at all, please do let me know. Okay, so just while we're doing that, I'm just going to get your overall check of your heart. I need you to breathe like normal. Don't take a deep breath in. Just breathe as you normally would. Very good. I'm just listening here to see that there is no double beat, no stutter in your overall heart. I just want to make sure it's beating healthy. Making sure all the blood is going in the chambers correctly. Does seem like you have quite a strong heart, so it's not too much to worry about. Okay, that seems all right. I'll be taking this off your arm now. Just hold very still for me. Thank you. Let's see what we got here. 120. Okay. Within the normal range. Just to confirm, you're not taking any heart medication, are you? Okay. If so, what is the name of it? Perfect. Now we'll begin with the actual evaluation. To begin with, I want to do a quick little eye check. I just want to ensure that your eyes are working properly just before we get into everything else. So as you can see here, I have two little sticks here. I want you just to tell me when they leave your peripheral vision and when they re-enter it. Very good. So just focus on my face, and then when these leave your peripheral vision, please let me know. Perfect. We'll do this vertically as well. Brilliant, thank you. Now in a very similar case, I'm going to be covering just your left eye here. I'm going to be having different numbers. It's like 1 to 5 on my hand. I would like you to tell me what you're seeing, what number it is. Very good. I'm just going to cover your eye here. Perfect. Now just for the other eye. Now, have you noticed any blurriness lately? Any issues with your vision? Any worries with it? Any floaters? Okay. And now, when was the last time you saw an optometrist? All right. That seems all right. I'm going to take a quick little look in your eyes here. Let me see. Take a quick little look in your eyes here. Let's see here. Do you tend to stay up quite late? Mm-hmm. Do you have any irritation or redness typically? Okay. It seems like the overall sclera of your eye is quite red, which is a little bit concerning. This could mean either dryness, lack of hydration in your eye. It could also mean you're staying up a bit too late, possibly watching videos late at night, it's on your phone too much. Mm-hmm. And do you tend to wear glasses? Okay. And do you wear sunglasses when it's sunny out? Very good. Okay. So right here I have this measuring tape per se. I will be showing it just up close to you like this and a little bit further away. I would like you to tell me what is the closest number you're able to see. So this could be a little test here. I'll show it like this and you might see the number 10. Mm-hmm. Very good. So please tell me what is the closest number you're able to see. Very good. And now what is the furthest number you're able to see? Okay. And the closest number? Okay. And now once again, what is the closest number you're able to see? Perfect. And the furthest number you're able to see? Lovely. Just one last one. What is the furthest number you're able to see? Perfect, thank you. And now we're going to do one last test for your eyes. I have a little light here. I will be shining it just up and down for your eyes. I would like you to focus on my fingers here. Just as I'm shining that light, I'm just looking for the overall pupil dilation. We expect it to constrict quite a lot when we have the light in front of it and expand when we move it away. So just look at my fingers, focus on my fingers. Very good. Now on the other side. Perfect, thank you. The next one we'll be doing is a sense of touch. I'll be using this very light brush just to lightly trace over your face, just kind of go around your face. I want you to let me know if you can feel it, if it is quite soft, if it's a little sharp, just the overall sensations you are feeling from it. Perfect. So let's hold still for me. Very good. Next, I will be very lightly just feeling around your face. I want you to just let me know if you feel any pain, any pressure, and whatnot. I'm just mainly feeling for any lymph nodes, any bumps, or any lumps that are not supposed to be there. Have you noticed any just like slight bumps? Okay. And do you tend to bruise easily? And when was the last time you had your thyroid checked? Or any blood work done? Okay. If you want, I can write up a letter for you to get some blood work done. Just to make sure all the nutrition's there, that all your levels are quite safe and healthy. Okay. I'm just going to be feeling by your collarbone, a little bit on your arms. And would you say you've had any muscle pain, any tenderness? All right. Well, I'll be very lightly pulling your head over to the left side and to the right side. I like you to resist. Don't allow me to move it or pull it either way. Just try to keep your head straight and stable, okay? Brilliant. So resist. Don't let me move your head at all. Perfect. Now we'll be doing it for up and down. So do not allow me to push your head down. And similarly, do not allow me to push your head up. Very good. Good resistance for that. Overall, nothing too notable to mark. I would like you to take a big breath in and kind of puff out your cheeks. To very lightly squeeze your cheeks just to really release the air. Let's see. Perfect. One more time. Brilliant. So I'll be just kind of moving around your hands on your face, just feeling for the overall muscles, how developed they are, if there's any issues with them, any decline or decay of them. So I'll need you to smile when I say smile, frown when I say frown, and so on. Okay, perfect. Hold still. I just want to feel your resting face. Now, can you give me a big smile? Very good. And now a frown. Frown your eyebrows as well. Frown your cheeks and your eyes. Very good. And now can you just give me a very neutral expression? Very good. And now as if you're shocked, like something very surprising happened. Brilliant, thank you. Next we'll be moving on to your overall sense of hearing. This is to do also a bit with the balance and a little bit of the touch test that we just did. This is similar to when I was moving your head back and forth, kind of just getting your overall sense of stability. With your hearing test, although we will be focusing on the hearing itself, making sure there's no issues, no delays, we will also want to make sure that the overall stability, as most of the balance comes from just the main organs inside the ear. So we'll be doing a few little tests for the sense of hearing. I have this little shaker right here. I'll be very lightly just turning it back and forth, very lightly, just around your head. I would like you to tell me, is it on your left side? Is it on your right side? Kind of where it is around your head. So of course, I'll get you to close your eyes for me. Just keep them closed. Don't let me see you. Perfect. Keep them closed. So just tell me, is it on your left side? Is it on your right side? Perfect. Now you can open your eyes again. I'm going to be whispering a few different words in either your left ear or your right ear. I would like you to tell me what you're hearing, what word it is. Perfect. Chocolate. Lavender. Vanilla. Pecans. Pink. Strawberry. And I'm going to actually take a look at the overall structure of your ear. You have the three main parts, which is the outer ear, middle ear, and inner ear. Although we can't look at the actual inner ear at this moment, we will look at the outer ear and middle of the ear. So for the outer ear, I'm just going to give a quick little clean. We'll swab it down quickly. Now, have you had any issues with your hearing, any ringing, any overall pain, sharp sounds, or phantom sounds? Now, on a scale of 1 to 10, has your hearing gotten worse within the past few months, better? And now, do you listen to loud music, headphones a lot? Do you go to any concerts, any events like that? Okay. And do you use ear protection? It is quite vital that you do use ear protection when you do go to concerts and such. In your ear, you have, in your cochlea, which is in the inner ear, you have little hairs which essentially take the sound vibrations and then you're able to turn them into electrical signals for your brain. If you don't have ear protection and you're listening to very loud sounds, such as mowing the lawn constantly, just without ear protection, it can cause them to be wear down and they won't be able to transmit and absorb and send out the sounds as well. It's something that we tend to see in construction jobs, anything you're possibly mowing the lawn, loud music, in your car at a concert. This is something to be careful of. Alright, I'm just going to take a quick little look inside your ear. Let's see. Now, this one's a little red. Have you been swimming recently? The weather has warmed up. Okay. So any swimming, any bodies of water? Have you had a recent shower? Okay. And now just to confirm, when you are cleaning your ears, do you use a Q-tip? Do you use a little scraping tool? How do you clean your ears? Alright. And now if you use a Q-tip, are you just using it for the outer ear? Are you shoving it inside your ear? How are you? Just kind of walk me through the process of that. Okay. So it's very important just to ensure that you're not putting the Q-tip actually inside your ear. They're not specifically made for that. They can be used just to absorb the new water if it goes in, but you don't want to actually shove it into your ear. That will cause the overall earwax in your ear just to get a little bit deeper, kind of plug it up, and it can damage your ear if you put it too far in. You have a few tiny bones in your ear which will amplify the overall hearing, which then will send it to your inner ear. However, those can be easily damaged if you stick it in a bit too much. So ideally, like just what I was doing previously, just use it for your outer ear. Try not to put it too much in your inner ear. If you do, be very, very careful and just do the very light outside. Perfect. Now I'll do a very quick little snap test. So I'll get you to close your eyes for me one more time. And on either side of your head, I will be snapping my fingers. Please tell me if it's the left side or the right side. Perfect. Just keep your eyes closed. Don't let me see you open your eyes. Keep them closed. Very good. Now, is this on your left side or right side? Very good. That was all correct. All right, now we'll be moving on to your overall sense of smell. So we have a few different items here. Each I'd like you to tell me just what you can scent, if there's any specific smell you have that's gonna stand out to you, and kind of what's the most recent memory of that smell. Does it remind you of your childhood? Does it bring back any fond memories? Take a deep breath in. Perfect. Now what does that smell like to you? Okay. And when was the last time you smelled that? Okay. Yes, that was grass clipping. That was correct. Now this one I'm just going to spray it into the air. Just tell me what it smells like to you. Pineapple, very good. Take a deep breath in. What does that remind you of? Not quite. It is a flower though, so do you want to try guessing again? Yes. Very good. One last one. Let's take a big breath in. And what do you say that reminds you of? Okay. Yes, that was caramel. Now for our last one. Perfect. That was like a rain dew, like the morning rain. Yes. Perfect. Quite good on that regard. Now for the next test, we'll be doing a quick little memory test. So I have some playing cards here. This is a normal deck. I'll give them a quick little shuffle. Have you noticed any delays in your memory? Any issues with it? I see. Okay. So we have a King of Spades. We have a 3 of Clubs. 3 of Diamonds. 7 of Hearts. 10 of Hearts. And the 4 of Clubs. Now, what was the second card I showed you? Very good. That was this 3 of Clubs. So we'll be doing a few tests just like that. It'll be a short little memory test, just looking on your short-term memory of how you can do memory recall. Overall, it'll kind of show us how active and healthy your brain is and the activity of it. All right. So we have the 4 of Diamonds, the King of Diamonds, Ace of Clubs, 7 of Clubs, 10 of Diamonds, 7 of Diamonds, two of clubs. One side spades for that. And lastly, we have the 6 of diamonds. Now, how many red cards did we have? So the red cards would be the diamonds or the hearts, and then the black cards would be the spades or the clubs. 4, very good. 6 of spades. 2 of spades. Queen of hearts. Jack of diamond. 2 of hearts. 8 of diamonds. 10 of spades. Now, what were the lowest cards I showed you? Do that one more time now. The 4 hearts. The king of hearts. We have the 5 of diamond. 3 of heart. King of clubs. And the 6 of hearts. Now, what was the third card I showed you? Make sure you have the suit and the number correct. Very good. That was the 5 of diamond. It seems like your memory recall overall isn't too bad for your age. It's not something we were too worried about giving your previous information and your previous testing with us. However, we do like to do the memory check just to see if we have any decline, any increase, and whatnot. It is, of course, very important to always try to do memory games, memory tests, and whatnot, as we like to predict and prevent stuff like dementia, Alzheimer's, and whatnot. That's quite important as you do age. Very good. Now, for our last little test, we'll be doing the sense of taste. Before we continue that, though, I'd just like to take a quick little look in your mouth. Just want to make sure that there's no issues. Okay, please open your mouth for me. And now, when was the last time you saw a dentist, orthodontist, or whatnot? And would you say you've had any pain recently? Any issues with your overall oral hygiene? Okay. Have you had any toothaches, tooth pains, and whatnot? I see. And do you brush, floss regularly? Ideally, trying to brush 3 times a day. Although I'm sure you get that lecture enough by your dentist, I won't go too much into it. I just want to make sure that there is no concerns. Now I'm just going to shine this light just at the back of your throat here. Say, ah. Very good. It's a little irritated and red. Do you tend to have spicy food or very crunchy, sharp food often? We do notice that can cause irritation for the back of the throat. Can just cause some redness. Again, nothing to be worried about. That's just simply irritation. If there was any buildup, any phlegm, any blood that you've noticed from coughing, whatnot, that is a concern that you would then go see a doctor for the emergency, given the overall realm of what's happening. All right. Well, let me just take a quick little look. And all right. So I have a few different liquids here. All have different scents and different tastes. So I will get you to just take a big gulp of it. I'll put a few drops in. I just want to ensure that you're able to have a valid and good sense of taste. Very good. What does that taste like to you? Okay. Now one more time. Just tell me what this tastes like to you. Okay. I would say it's more of a sweet thing, something more sour. Okay. All right. Well, it seems like your overall sense of taste is quite adequate. Nothing to be concerned about. It does always switch a little bit if it's more sweet, more sour, for individual to individual, just as our taste buds do change and develop over time. However, I believe that is most of our concerns and worries that we wanted to check up for today. Have you noticed any additional, or do you have any additional questions, worries, or things you'd like me to check? Okay. Well, I will have my receptionist send out a blood work paperwork for you. So we can get the general check, just check your overall thyroid. We can check, make sure your liver is healthy, that you don't have too much protein. Just an overall general check for you is a common practice here. Yes, it should be done ideally every 6 months for some blood work, is what I personally would recommend. However, it does change if you talk to a general practitioner or whatnot. Perfect. Well, if you have any questions or concerns within your test results and the files that we send you after this appointment, please feel free to call back and we can have some clarification. You can come in for another test if needed. So I believe we'll need to book back in 6 months. Perfect. Well, then I will see you then. Just book a date with the receptionist and I'll be sure I'll be able to fill you anytime. Brilliant. Well, it was lovely seeing you and thank you for coming in. I hope you have a great night and safe travels. Bye-bye now.